mynews.studio.
A reactor running hotter than the sun for 17 minutes in China, Brazil eliminating mother-to-child HIV transmission, and France banning forever chemicals. Are we seeing the start of a new chapter in health and energy?
Today's date is January 26, 2026. Let's begin with that fusion milestone in China. 17 minutes of stable, high-confinement plasma at over 100 million degrees Celsius. That's more than doubling their previous record. But what does this actually mean beyond the headline?
It's a meaningful step toward making nuclear fusion a usable energy source. But we haven't crossed the finish line. Sustaining those conditions over much longer periods, actually achieving net energy output, and converting that into electricity efficiently, those are the big hurdles still ahead. The East reactor's result is real progress, but it isn't the end point.
So, in terms of what we can expect, are we on the verge of commercial fusion, or is this still more of a long-term goal?
Commercialization is still quite a way off. Projects like ITER in France are aiming for sustained fusion on a much larger scale. But their first full tests aren't expected until at least 2039, and even that may be optimistic. After that, building actual commercial plants and connecting them to the grid will take several more years.
Why is international collaboration so crucial with fusion? Couldn't a country like China just keep pushing on its own?
Fusion is a challenge that goes beyond any one nation. No single country has all the needed expertise or resources. Take ITER as an example. It brings together China, the EU, the US, and others. Sharing data and hardware, working through technical problems together. That's how progress speeds up. Otherwise, we risk repeating mistakes and missing out on breakthroughs.
For listeners watching this field, what should they be looking for next? What would signal that fusion is moving closer to reality?
Keep an eye out for longer plasma operations, real evidence of net energy gain, and progress in developing materials that can handle those extreme conditions. Those are the indicators that fusion is shifting from lab experiments to something that could power cities.
Let's move to Brazil, the first country with a population over 100 million to eliminate mother-to-child HIV transmission. How did they manage that?
Brazil took the World Health Organization's guidelines and made them work at a national scale. That meant universal prenatal care, routine HIV screening for expectant mothers, and free antiretroviral treatment, especially with drugs like dolutegravir. Importantly, they didn't just focus on big cities. They integrated testing and care into primary clinics everywhere, using community health workers to reach even remote regions.
Transmission rates dropped below 2%. That's a dramatic reduction. Did they face much resistance to these efforts?
There were real challenges. Rural access isn't easy, and stigma hasn't disappeared. But political will kept funding in place and made all these services free under Brazil's unified health system. That's been the foundation. Other countries can learn from this, but the big question is whether they'll make the same investments and tailor programs to their needs.
So, the lesson here is bigger than just HIV. It's about what's possible when healthcare is truly universal and proactive.
Yes, exactly. It shows that combining science, good policy, and on-the-ground action can tackle even complex health issues. These kinds of public health victories are achievable.
Switching to France now, banning all forever chemicals in cosmetics and clothing from this month.
PFAS, or forever chemicals, don't break down in nature. They build up in the environment and in people. France's ban covers a wide range of products. It forces industries to look for safer alternatives, but actually enforcing the ban is going to be complicated.
Why so complicated? Isn't it just a matter of stopping production and sales?
Detection is difficult. These chemicals can exist in products at extremely low levels. Plus, supply chains are international. Goods cross borders, and not every country has the same rules. So real enforcement needs cooperation between countries to close any loopholes.
Could this trigger other countries to adopt similar bans? Maybe a domino effect?
It's possible. The European Union is keeping a close watch, and so are markets in the US and Asia. If companies adapt and consumers push for safer alternatives, we might see more bans, but it will depend on political commitment and how fast industries can adjust.
So, in just a year, we've seen a major fusion achievement, a public health milestone, and a sweeping environmental regulation. Are these just isolated successes, or are they signs of a larger trend?
They're connected. Each is the result of science, policy, and collaboration. Together, they show what's possible when countries set clear priorities and work together. The next challenge is whether these breakthroughs can scale up and last.
That's the big question. Are these examples the start of something bigger, or are they exceptions?
We'll have to see. But they do provide hope and a path forward.
A fusion reactor runs hotter than the sun. Brazil brings newborn HIV transmission to zero. And France bans chemicals we once thought would last forever. These aren't just headlines, they're signs of change.
Thank you for joining us. This episode was brought to you by mynews.studio. Try it now for free.